My name is Raymond Hwang. I'm an orthopedic spine surgeon here in Boston. I practice out of the New England Baptist Hospital, and I'm also faculty at Tufts University School of Medicine.
My name is Peter Whang. I am a spine surgeon in the Department of Orthopedics Rehabilitation at the Yale University School of Medicine.
I've been using the Misonix bone scalpel now for more than 10 years, and I use it routinely for any decompression that's more than one level. The rationale for this is that, in my opinion, the bone scalpel really provides an additional level of precision when it comes to the decompression. It allows us to preserve as much bone stock within the native spine while also allowing us to harvest as much bone for autograft. The bone scalpel also cauterizes as it cuts, and so it decreases blood loss. And the decompression itself is made safer by the absence of a spinning bird tip. This allows us to perform decompressions with a lot more confidence. It's obviously a great benefit to patients as well.
I was first introduced to the Misonix bone scalpel several years ago. And while it is a very versatile tool that is ideal for many different types of procedures, such as decompressions or tumor resections, I use it primarily for my cervical and thoracolumbar laminectomy procedures.
At this point in my career, can't imagine performing multi-level decompressions without the bone scalpel. It really has changed the way that we perform our cases, and especially at 2 levels or more, it makes our cases actually a lot faster too. So a lot of benefits to the bone scalpel, and I think that it is an integral part of my surgical practice.
I think the Misonix bone scalpel is an example of a technology that has really revolutionized my practice. It allows me to perform these types of decompression procedures in a more efficient and safer fashion, which is not only good for the patient, but also for me as well. And I think if you talk to a busy surgeon, what you begin to realize is that what is more important than almost anything else is saving time. So I think this really is a technology that is going to resonate with surgeons.
I've been using the Bioventus OsteoAmp fibers now for more than 2 years. I use them routinely in my lumbar and posterior cervical fusions. It's my graft of choice. I find that the OsteoAmp fibers are unique in their format. The fiber format, in my opinion, is uniquely constructed to the interstices and irregular topology of the fusion surface.
One of my primary clinical research interests has always been biologics for spinal fusion. And I was actually an investigator for the OsteoAmp trial, looking at its safety and efficacy in the posterior lateral lumbar spine. At this point, I really use OsteoAmp for generally all of my spinal fusion procedures. I think based upon its biological activity and its handling characteristics, it's really ideal not only for the interbody space, but also in the posterior lateral gutters as well.
In my practice, it's allowed me to reduce the exposure for nearly any surgery, allowing me to create open fusion type bone biology in a much less invasive approach. And this obviously is great for the patient. It reduces the incision, reduces blood loss, and makes the surgeon's life easier because you're able to apply the bone graft confidently in the same place reliably and know that you have this powerful bone graft that's going to help fusions occur. When I get post-op CT scans looking at these fusions after using the OsteoAmp fibers, I honestly have never seen such robust fusion masses. They are extremely satisfying to see and quite unequivocal. So in my mind, for me, moving forward, it's hard to imagine performing these fusions without the OsteoAmp fibers. So very important to my practice at this point. And I consider it not only an important component of the fusion, but it actually drives a lot of the techniques that I use at this point. Knowing that I can, through a small incision, apply this bone graft reliably, it's really altered the way I perform fusions sort of from top to bottom. So in my opinion, that's a great sign of true innovation. It's really pushing the entire procedure in a better direction.
I think as surgeons, we realize that spinal fusion is a biological process. So regardless of what screws and cages we use, at the end of the day, we are still dependent upon the type of biologic we use to stimulate bone formation. And I think that OsteoAmp really kind of fills a void in terms of efficacy, safety, cost effectiveness. And we also have data to support all of these different factors. So I think OsteoAmp really does kind of fill a void in my practice in terms of biologic that I can use on a daily basis for my spinal fusion procedures.
So I'm extremely excited about the union of Misonix and Bioventus, two companies that, in my mind, have truly unique products that bring differentiated value to the market in a field with a lot of companies that don't necessarily seem very different from each other. I think this is a unique characteristic. So I think the future of spine innovation is extremely bright, knowing that Misonix and Bioventus are now working together and joining forces.
Misonix and Bioventus are not your typical spinal implant companies that bring commodities like screws and plates to the market. I think what really differentiates Misonix and Bioventus is that they focus on the unmet needs of surgeons, bringing differentiated technology to the market so that we can take better care of our patients.